see one.
Come here.
Hello, how you doing?
Fine.
Good. My name's Amy. I'm your nurse for the day.
Okay.
You must be Devin? Hi, nice to meet you. This is Dad, Mr. Harding?
Yes.
Nice to meet you. Well, I just talked to the doctor, and he told me that he was going to have you go take a test, to kind of see what's going on with Devin, and
Okay.
try to narrow down a diagnosis.
All right.
Okay, so he's going to come in, explain the test with you a little bit more,
Oh, okay.
and then I will come back in and I'll take you down to the test.
Oh, okay.
Okay? And you're more than welcome to go down
Good.
with him. So you'll be able to stay with him the whole time. Doesn't take very long. And then, once we get the test results, we'll come back and we'll discuss what they say.
Okay. Sounds good.
All right, so he'll be in just a minute.
All right.
You guys doing okay?
Yeah.
All right, need anything?
No.
Okay. All right, well, I'll go get Dr. Myers and let him know that you guys are ready.
Thank you.
Okay, sure.
Hi,
Hi.
hey Dion, Barry,
Nice to meet you.
Dr. Myers, nice to meet you. So who we have here, Devin?
Yes.
All right, Devin, I'm Dr. Myers, nice to meet you, buddy. That's a cool looking toy you got there. All right, so I understand we kind of came in for some shortness of breath today. Happened during a football game?
Yeah.
Okay.
So, after he was running, he couldn't catch his breath and I heard a whistling sound.
Okay.
So, and it happened last week.
Last
So,
week, okay,
it's starting to become a habit, so I thought we should get it checked out.
okay. Yeah, kind of what we're kind of leaning towards with what we're seeing as far as signs and symptoms, especially with the whistling noise that you're describing, is something that we call asthma.
Okay.
And what that is simply it's a narrowing of the airway in one way or another, okay,
Okay.
which is what's creating that whistling noise that you're hearing. Kind of just a brief summary. It can happen in different ways. It can be from mucus that's causing the airway to shrink. But what I think more was happening with Devin here is we have smooth muscle that lines around our airways. And sometimes when we're exercising, we can actually irritate that smooth muscle and it causes it to constrict.
Okay.
When that happens, it starts to narrow basically the diameter of our airway. Okay, so it's restricting that flow of air, which is what's creating that whistling that you're hearing. Okay, so basically, same way that you would whistle through your mouth is what's happening in his airways. Okay, pretty common. Not necessarily the most uncommon thing. So something that is treatable.
Okay.
Okay, if that's what it is. So what we're going to do though is we're going to kind of try to mimic the scenario that he's having. Since it's only happening when he's exercising, he's not waking up in the middle of the night with coughing or anything like that, is he?
Not that
Okay.
I noticed.
Good. So what it sounds like is it's an exercise induced. So what we're going to try to do is mimic that scenario. Okay. So when we take him, we're going to take him over to the pulmonary lab and do basically a test on him, kind of see if we can't mimic that and cause that bronchospasm to happen that we think is going on.
Okay.
You'll be able to go with him.
Good.
Okay, so he'll have you there. We'll be monitoring him. We'll keep track of his heart rate, his oxygen levels. We'll be keeping a close eye on him.
Okay.
Okay. Since it is exercise induced, like I said, we might have him run on a treadmill.
Okay.
Okay. Or kind of run laps. However we're going to do that. Okay.
Okay.
So at the end of the day, I do have a packet to give you if this is asthma, but we will have the medication that we might want to try with Devin over there. We might test that out to see if we start to see that bronchospasm happening or hear it, that whistling noise that you're describing. We'll probably try what we call an inhaler. That'll deliver medication to the lungs and see if we can't reverse that effect. Okay?
Okay.
So you have any more questions for me right now?
Not right now.
All right. Well, your nurse will be back in here in a second. She'll take you down there.
Okay.
We'll get you all sorted away, okay?
Okay.
All
Sounds
right.
good. Thank you.
Thanks. See you in a little bit.
Okay.
All right. Thanks, Devin.
All right, guys, you ready? All right, I'm going to take you down to get that breathing test we were talking about earlier, okay?
Good.
All right, so you just follow
You
me
grab
and Dad can
Salvador?
come. Yep, you want to grab your toy? You can bring him too. All right, let's go.
Go in a circle, go back in, sit back in.
All right, good job. So your test is complete. So now that you're back, I'll go let Dr. Myers know that you're back and that the test is complete. Right now, what he's doing is reviewing your PFT results, okay? And then he'll come in, explain those to you, and explain how he did, how Devin did, and kind of where we'll go from there.
Okay.
Okay, and then after that, the respiratory therapist will come in and they'll explain a few things to you, and then I believe you guys will get to go home.
Oh, good.
Sound good?
Yep, you're ready to go home, aren't you, buddy?
And that,
Okay.
all right, well, it shouldn't be too much longer, okay?
Okay,
And then I will be getting paperwork together so you can do that,
all right.
okay?
Yep.
All right, do you need anything?
Anything?
Kevin, you're good? Okay, well, you did awesome. All right, guys,
Thanks.
thank you.
Hi,
Hey.
back. We'll see you guys again. How we doing? Doing all right? Good. All right, well, we were able to review your tests.
Okay.
And it does look like we're having a restriction in the airways, especially when exercising, okay? So what we're gonna do, you did react very well to the medication that we gave, which is just called albuterol.
Okay.
Okay, so what our plan is today is to send him home with an inhaler, similar to what we used in the lab, okay, to try to treat that condition. So, like I said, what's happening is he's having basically a smooth muscle constriction around his airways.
Okay.
You know, it is something that is very treatable. Some cases are a little bit more milder than others, okay, just to let you know.
Okay.
Sometimes it does get a little bit more severe, and sometimes those inhalers might not reverse that effect right away, okay? In that case, if he's really having a hard time breathing, don't hesitate to bring him into the hospital,
Right.
okay? We don't want to wait too long with that, all right?
That's why I brought him in the
Yeah,
first place.
so we do want to make sure of that. And there are some side effects to that albuterol, okay? Which I have in this packet that we have for you as well, which has some asthma education as well as phone numbers for all the pulmonary doctors here, okay? So what we can do with that is any questions that you have, don't hesitate to call us, okay? If you can't find them in here, you can always pick up the phone and give us a call.
Okay.
Okay, so the main thing we want to do is make sure that you act quickly with it. If you see him coughing or really having a hard time, like he's kind of struggling with his shoulders or anything like that, you really want to make sure you pay attention to that, okay? And so if you start to see to where he is really working hard to breathe, make sure we're taking a listen to him. If you're a little bit farther away from him, try to get a little closer to him, see if you can hear any type of audible wheezing like you heard, okay? So with that, we'll have a respiratory therapist come in and teach you all about the inhaler, how to use it, and also how to maintain it. So, like I said, with the albuterol, there are a few side effects. It can increase your heart rate. It can also cause some headaches. The main one for kids might make them a little hyper. Okay, so apologize in advance.
Okay.
All right, about that. So might make them a little bit hyper. Bounce off the walls a little bit. Typical side effect with kids. Okay, so I'll give this to you.
All right, thank you.
You have any more questions for me right now?
No.
All right. Well,
He's losing patience, he's just ready to go.
yeah, sorry. So I'll get the respiratory therapist and let them know, have them come in and teach you how to do it, and we'll get on our way, okay?
Yep.
All right, don't hesitate to call with any questions, all
Thank
right?
you.
Thanks, thanks, Devin.
Hello, I'm Adam from Respiratory.
How you doing?
Good.
Good.
Mr. Harding?
Yeah.
Hi Devin. I'm just going to show you how to use your medicine today, okay?
Okay.
The doctor has prescribed some albuterol,
Okay.
and this one is called Benylin. This is an inhaler, and this is a chamber. This just helps get this medicine into your lungs a little easier and more efficiently,
Oh, okay.
deeper in there so it works better.
All right.
All right, there's a counter on the back that shows you how many times you have released the medicine.
Okay.
And when it'll just let you know when you're getting low.
Okay.
Before you start using this, you need to prime it. Just away from your face and your body, just let it go. First time out of the box, we'll do it a couple times. But before use, just do it one time. So just it clears all the dust, and and dirt and anything that's been stuck in here, but you just want to keep the cap on it as well to keep it clean inside of there. So to help relax the smooth muscle inside your lungs, so it doesn't constrict it when he's running,
Okay.
you take 2 puffs of this, 10 to 15 minutes before the exercise that he's going to do, like running really hard, practice at football or even a game, and then this should help keep that smooth muscle relaxed during his exercise, so it won't constrict, and he won't have
That
difficulty
whistling sound
breathing.
that I've heard.
The whistling sound, which is wheezing and
Okay.
the shortness of breath and stuff like that.
Okay.
So, once you prime it, put it in here. Put your lips around this piece right here, okay? And then, when I push this down, take a deep breath in, slow deep breath in, as deep as you can. And I want you to hold your breath for 5 to 10 seconds, okay? And after that time is up, you can relax. And then you'll wait 1 minute between each dose, okay?
Okay.
So you take 2 doses, 10, 15 minutes before exercise.
Okay.
So, when you do, I'll show you how I'm going to do, okay? Just push this down. Take a deep breath in and hold it. 5 to 10 seconds. And then we'll have you try it, okay? All right. You want to try it? All right. On 3. 1, 2, 3. Hold it. 5, 4, 3, 2, 1. Okay. Blow out and relax. And breathe. We'll do 1 minute, and then you can try it again, okay? And did the doctor say the possible side effects of this medicine?
Yeah, he did mention some.
Well,
Mostly
that's just
hyper.
Hyperness, maybe shakiness, might get lightheaded, headache,
Okay.
or nauseous, but that's not as common as just jittery or extreme hyperness in kids. But you might not notice it since he's running around.
Yeah,
Anyway,
right.
but he'll have a increased heart rate as well. And on the spacer, you need to clean this about once a week.
Okay.
Warm, soapy water. Don't use any brushes or any utensils that can scrape the inside or outside. Just warm, soapy water with a rag, and then rinse it out, let it dry, air dry,
Okay.
and you'll be good.
Okay.
Same thing with this piece. You take this out, rinse this out, this piece. Do not put this in water. This doesn't need to get wet. So, are there any questions? No? All right, well, if this doesn't seem to work when he's during exercise, and he's still coughing real bad, and he seems like he can't catch his breath or breathe, don't hesitate to call or come in.
Okay.
And maybe we need to change his dose,
Right.
or maybe there's another trigger that's causing this asthma. But,
Besides just the running
so if you
fast.
if it seems to not be helping, don't hesitate to call.
Okay.
All right, well, thank you for your time, and
Thank you.
hopefully I'll see you again too soon. All right, thank you.
All right, guys. I just have a few, your discharge paperwork.
Oh, good.
A few numbers for you.
All right.
You got your medication. Did they leave it in here?
Uh,
I'll grab it for you,
Okay,
Lee,
all
don't
right.
worry about it, because that medication that the respiratory therapist went over
Uh-huh.
with you, you're actually gonna be able to take that home with you,
Okay.
okay?
Mhm.
And then I've highlighted the pharmacy's number on this piece of paper, so once Devin is getting low on his dosage of his inhaler, then you'll want to give them a call, and we'll have that ready for you, so he's not ever out of it.
Sounds good.
Okay, so that's highlighted here,
Okay.
and then that's your discharge paper, and you guys are all set, you ready to go? I bet. All right. Well, you did great.
Thank
Any
you.
questions?
Nope.
All right. Well, it's nice to meet you guys. Take care, okay?
Thank you.